Hi, welcome to the Healthy Life channel. Have you ever noticed your body sending subtle signals, such as needing to urinate more frequently at night or experiencing unexplained facial swelling? You might think it's just a coincidence. But did you know that, according to the World Health Organization, chronic kidney disease silently affects hundreds of millions of people worldwide? What's alarming is that most of them aren't even aware their kidneys are in trouble until the condition reaches a severe stage. The kidneys, small organs located at the back of your body, play a crucial role in detoxifying the system and maintaining fluid balance. When the kidneys start to deteriorate, the body actually sends out warning signals, but we often overlook them. These signals can manifest as simple symptoms, like unusual fatigue, sudden itching, or unexplained shortness of breath. The problem is, most people don't associate these signs with their kidney health, allowing the condition to worsen unnoticed. Ignoring these early warning signs can lead to far more serious complications, ranging from high blood pressure to heart disease. So, what are the early signs you should be aware of to protect your kidney health early on? 8. Loss of appetite. Loss of appetite is a symptom that is often not immediately associated with kidney problems, but can be a significant indicator of impaired kidney function. When the kidneys fail to filter waste effectively, accumulated substances in the blood, such as urea, can affect the digestive system and cause discomfort in the stomach. This can make you feel full more quickly or lose interest in food altogether. Additionally, a decrease in appetite is often accompanied by nausea and vomiting, which can exacerbate dehydration and further weaken the body. This persistent loss of appetite is often a sign that the body is struggling to cope with toxin buildup, and if left unaddressed, it can worsen kidney health. If this symptom occurs alongside others like fatigue or swelling, it's crucial to consult a doctor promptly. 7. Ammonia-like breath. One distinct sign of kidney problems is breath that smells like ammonia. This odor is caused by a buildup of urea in the blood, which the body produces as a waste product from protein metabolism. Healthy kidneys typically eliminate urea through urine, but when the kidneys are damaged, urea breaks down into ammonia in saliva, creating a characteristic odor in the breath. In addition to bad breath, this condition is often accompanied by a loss of appetite, especially for protein-rich foods like meat. This occurs due to the discomfort caused by the buildup of toxins in the bloodstream. The smell not only impacts physical health, but can also affect psychological well-being, as it may lower self-confidence and strain social interactions. 6. Excessive fatigue. Excessive fatigue is a frequently overlooked yet common symptom in individuals with kidney damage. Healthy kidneys produce a hormone called erythropoietin, EPO, which stimulates the production of red blood cells. When the kidneys are damaged, the production of this hormone decreases, leading to a reduced red blood cell count. This condition, known as anemia, means the body's tissues do not receive enough oxygen. A lack of oxygen causes the body to feel tired and weak, even after adequate rest. Additionally, people with anemia due to kidney damage often experience constant fatigue, difficulty concentrating, and memory issues. Everyday activities, such as walking or even getting out of bed, may feel exhausting and draining. Over time, persistent fatigue can impact mental health, increasing the risk of depression and reducing productivity. If fatigue persists despite sufficient sleep, it's essential to seek medical evaluation to determine if kidney health is contributing to this symptom. 5. Skin itching. Itchy, dry, or even burning skin is a common symptom experienced by individuals with chronic kidney disease. The kidneys are responsible for removing excess phosphorus from the body. When kidney function declines, phosphorus levels in the blood rise, leading to chronic itching. This itching is usually not localized to one specific area, but spreads across the body. The skin may feel dry, rough, and can crack if scratched excessively. Additionally, the buildup of toxins in the blood contributes to this symptom, as damaged kidneys cannot efficiently eliminate metabolic waste. Chronic itching can be particularly disruptive at night, leading to sleep disturbances. In severe cases, the itching can become so intense that it significantly affects quality of life. Furthermore, damaged skin from frequent scratching can become an entry point for bacterial infections. Fourth, shortness of breath. Kidney dysfunction can cause fluid retention, leading to fluid buildup in the lungs, a condition known as pulmonary edema. When the lungs are filled with fluid, the body's ability to obtain oxygen is impaired, making it difficult to breathe. This is a serious symptom that requires immediate medical attention. Shortness of breath in kidney disease patients is often more pronounced when lying down or following mild physical activity. Additionally, anemia, a common consequence of kidney damage, worsens shortness of breath by reducing the oxygen supply to the body. This condition forces the heart to work harder to pump blood, increasing the risk of cardiovascular complications. Persistent shortness of breath, especially during routine activities, is a warning sign that the kidneys may be severely damaged. Third, lower back pain. Pain in the lower back or along the sides of the body is a common symptom of various kidney issues, such as kidney infections or kidney stones. Kidney stones are hard mineral masses that form in the kidneys and can cause severe, sharp pain when they move or block the urinary tract. In addition to kidney stones, polycystic kidney disease, a genetic condition that leads to the formation of cysts in the kidneys, often causes back pain as well. This pain is usually localized beneath the ribs and may radiate to the groin area. Frequent and persistent back pain is a strong indication of serious kidney problems. If this pain is accompanied by other symptoms like fever or nausea, it could signify a kidney infection requiring immediate medical attention. 2. Swelling in the legs and face. The kidneys play a vital role in maintaining the body's fluid balance. When kidney function declines, the body tends to retain more fluid that would normally be eliminated through urine. As a result, fluid accumulates in the tissues, particularly in the legs, ankles, and face. This condition, known as edema, often causes noticeable swelling, especially in the morning or after prolonged standing. Edema in the legs may cause discomfort or even a sense of heaviness or pain in the swollen areas. Swelling in the face, particularly around the eyes, is often one of the earliest visible signs. When the kidneys fail to regulate electrolytes, particularly sodium, fluid retention occurs, leading to swelling. This condition should not be overlooked, as prolonged swelling can impact the performance of other organs, such as the heart and lungs. In advanced stages, untreated edema can lead to more severe complications. 1. Changes in urination patterns. Changes in urination patterns are among the most common and often the earliest signs of kidney problems. Typically, a person urinates several times a day, but individuals with kidney damage may experience drastic changes in this pattern. Some people may urinate more frequently, especially at night, a condition known as nocturia. This irregularity occurs because the kidneys lose their ability to properly regulate fluid balance. Damaged kidneys may also produce foamy or bubbly urine, a sign of protein in the urine, known as proteinuria. This happens because impaired kidneys are unable to filter and retain protein in the blood effectively. Additionally, changes in urine color, such as red or pink hues, may indicate the presence of blood in the urine, a condition called hematuria. These changes not only signal kidney dysfunction, but can also affect quality of life, as frequent nighttime urination can disrupt sleep. Recognizing these changes is crucial, as they indicate structural or functional damage to the kidneys. Maintaining kidney health is vital, and it starts with recognizing the early warning signs discussed. While these symptoms may seem minor, they should not be ignored. If you notice changes such as altered urination patterns, unusual fatigue, or swelling in your body, don't hesitate to consult a doctor immediately. Early detection gives us a greater chance to preserve kidney function and prevent serious complications in the future. Remember, healthy kidneys are essential for a high-quality life, free from chronic diseases. So, take good care of them, pay attention to subtle signals, and always prioritize your health. This video is for educational purposes only. If you find it helpful, don't forget to like and subscribe so you won't miss other videos.